This is Soup Business Landscape.
A new World Bank report has revealed that Nigeria's social safety net programs are largely ineffective, with only 44% of the total benefits reaching the nation's poorest citizens. Now, this comes despite billions of naira spent annually to alleviate hardship. Titled The State of Social Safety Net in Nigeria, the November 2025 report criticizes poor targeting, fragmented implementation, and weak funding as major obstacles hindering the impact. Now, it highlights that most vulnerable Nigerians remain excluded from relief schemes designed to support them. Now, the report calls for urgent reforms to ensure efficient delivery of safety net programs with better data, coordination, and funding mechanisms. It warns that unless the government addresses these structural flaws, its poverty reduction goals may remain out of reach, deepening inequality and economic vulnerability. Now, while I do not conform to the fact of giving handouts to people below average, because it can only sustain them for 3 months. I mean, how much are you going to give them? You can't even give them what is going to last them over for a year. So let's say 3 to 6 months, and depends on whether it's a single person or a man with a nuclear family. So, but then again, these safety net programs, does it get to the right people? I remember when it was early this year when we were sharing bags of rice, and a community got probably just this amount of rice to share within the community, within the street. And it was quite, people, came out, and we've had other social safety nets like that. I remember there was this one that people woke up to see 50,000 naira in their account. I was looking for it, but I guess I don't qualify in that sector. But this report now states that, data is one of the things that is hindering this. So first of all, we do not even know how many people are in Nigeria. We say 200 million. But is that actually the amount? Because we've tried to have a census year in, year out. Budget, earmark, plans, every other thing underway, but it never comes into fruition. And until we get census right, we cannot have data. Now, we have alternative source of data through the financial system, like the BVN, through the, the NIN, the National Identity Card, through some other means, bank accounts. We can get a fraction of people, but it doesn't really capture every other person, because it doesn't capture the informal sector. There are a lot of people that are unbanked. There's still a lot of people that don't have BVN, that don't have ID cards, voters cards. And I like the fact that Nigeria is moving towards a place whereby you will need either of these things. You will need either a passport, a BVN, an NIN, or something to get by. I like the fact that Nigeria is moving towards that. I like the fact that, the federal government, state government, we are moving towards e-governance. I remember there was a report I saw yesterday, particular sectors, they've uploaded to OneGov Cloud and all that. I like that fact that we are moving towards that time. But data is one of the things that we are still lacking, and it cuts across all sectors, whether it's for poverty alleviation project, anything. You need data. We need to know how many people are in Lagos, so that the right allocation gets to Lagos. How many people are in the north? How many people are in Kaduna? How many people are in Abuja? How many people are in Kano? How many people are in Abia State? Calabar and the rest of them, so that we know that, okay, this is the amount of people we have. Then we can now begin to say, okay, these are the people below average, these are the average, these are the upper class, and all that. So we know that the programs that we are doing then we can now specifically tailor programs to different sectors, different categories of people in the economy. What's your thought?
Well, it's more of an efficiency gap when you look at it. Data has been a problem, a big problem, an issue in Nigeria. We don't have a centralized registrar or register, basically harmonizing all of this information, the NIN, the BVN. I had an experience when I was in the UK where you can have access to food banks simply because you have certain documents. You'll see there are good intents when you see our politicians or leaders just wake up randomly say, "Oh, we would like to give palliatives, to people in the environment." Very good intention in this inflation period or era, but this is where data comes in. I had an experience. My mom told me this story of someone in the environment who works with the local government. Just brought in the executives, came into the environment with palliatives, and not everyone in that small community had access to this palliative. Why? Because data is a problem. I'm registered to a community. I believe my data should be on the platform of this community, which means if you're coming to render or give any form of palliative to the environment, you request for the data. How many people are living here? 65, 80 households. Okay, no problem. You create these palliatives according to the information that was given to you. And now you just don't disburse to the environment. There's a form of identity that every household has to say, okay, I am entitled to this palliative.
Yes.
That's the way you understand. That's how you tackle issues with regards to inefficiencies and all of that, and transparency. But because there's room for illegality, there's room for making money where in areas of governance where irregularities happens, you see that there's always a pushback when you want to discuss data and accountability, because data gives you accountability.
Yes.
It makes you responsible. You see people push back because they don't want this. They don't want you to know how many people receive the palliative. Why? Because the next household wants to collect 3 instead of 1. This other household wants to collect 5 instead of 4. And you don't know who to even hold responsible. Who exactly is responsible for this community? And can we see your information accessible to you? So data is a big issue, and we need to actually go smoothly to see how we can harmonize this. Registers. Why do I have an NIN and a BVN, and I still go out to do to try to carry out some national assignments, and without me giving you my NIN, you can't access certain information about me. It's difficult. You want to open a new bank account, and it's quite difficult to open it because you need me to get one thing. With my NIN, you should have access to that information. One time I was feeling under the weather. I think I was at Scotland, and I got to the pharmacy, and I just told this lady my NI number. And every information from where my GP was, everything came up. And I was right there like, interesting. I didn't have to say too much. I didn't have to show proof of who I am. I didn't have to go print out a passport. My information is right there in front of her, and she can see me. And I got access to medical care and all of that. So data is very important into our infrastructure, into our governance, our real estate, our health sector. We need to these information are there. Let's not throw away the hard work. The information are there. You go to your hospital where you have your family family card. Once you get there, there's a system that it comes up and all of that. But when you go to the general hospital, you still have to open a new one there and all of that. When you can easily just say, okay, I'm registered, and I think that's where the HMO comes in.
Yes.
But even at that, how many people have access to these things? Awareness and all of that. So there's a need for that. If not, this issue with regards to 44% of 44% of the benefits not accessible to it's really going to continue that way. People just wake up and say, "Oh, did you receive 20,000 from the government?" I received, but I did not receive. On what basis did you get that? On what basis did I not get it? Is it just because you're in the north or I'm in the south and all of that? On what basis? So this data harmonization helps you to understand better who gets this, palliatives, this benefits, and why I'm not getting at this point. In the US, I think I don't know where exactly it's in California or Canada as well too. There was a time when the inflation was really high. We saw videos of people in different provinces and the rest lining up to get packages and all of that because there's a data put ahead that we have so and so amount of people in this province that are accessible. And besides that, you have to have fallen short of certain situations to be able to get access. I'll give an example. Monzo in the UK, maybe some of the banks, or most of the banks basically, would call you if you have issues with regards to paying back your credits. And they ask you certain questions. Why are you unable to pay your credits and all of that? And they tell you, okay, you're not able to pay this. Are you going through a difficult time? Yes. These questions follow through. And then they tell you, okay, based on the information we've gathered and where you're staying right now, you have access to this food bank. in this certain environment. That's data. That's data. When you go there, you pick it up. The place, the food bank you're going to pick up this palliative or whatever, also have a data that is synchronized with the
System.
the system. So, and it's just as simple as that. I go to my family doctor or family hospital. I open a list, and for some days I need to go to the general hospital. Why do I have to open do a new system? You have to go and get my passport and all that. When you can just call in or get an information. All hospitals should be harmonized to the general hospitals within an environment and all of that. So it's just data. We need to work on this, and once we do that, trust me, a lot of efficiency gaps will be covered. So
Okay, let's come over to you, Onyepriye. What's your thoughts on this? It's quite a whole lot. Like I always say, there should be other ways. Yes, there will always be poor in the land. It's in the good book, as it says. But how can we ensure that we capture everyone? So if the government is going to dole out 10,000 naira for the less privileged actually gets it. What's your thought on this?
Okay, I know this question is directed towards the way and manner we manage our data and how the data can serve as an instrument for government workers to be able to carry out some specific government project with regards to the welfare activities and welfare disposition, the welfare responsibility that the government need to carry out to people of vulnerable nature or those who are unable to cater to their own economic needs at a certain stage. Some of this project, and we have the National Social Investment Program, which was pioneered by the government, and in that we have the conditional cash transfer, we have the government enterprise and empowerment program, the homegrown school feeding program as well. Now, all these programs do have their own positive impacts in the Nigerian populace. As for those who were able to take part of it, the conditional cash transfer and other cash transfer elements, help to raise the consumption and support human capital development amongst the vulnerable people at the grassroots in society. As a result of this cash transfer, some of the women who goes to trade are able to start their micro trading activities because they had access to it. Now, including the GEEP that empowers women, youth, and artisans by giving them access to loans for them to start their own private enterprise, loans ranging from 10,000 naira to 100,000 naira. And also the broader program has to do with channeling direct interventions to millions of beneficiaries of Nigerians across the Nigerian Social Investment Program to more than 4 million beneficiaries since inception. I know we're going to ask the question, do you know of anybody that got access to these loans, to these goodies? Yes, I know very, very few. I know very few people, but this is insufficient. I'm not going to try to placate or pancake the issue. We have a data issue, and that data issue is an issue that the government at the federal level, at the state level, in collaboration with the Ministry of, not only the Ministry of Communication and Information, but also with the subnational governments. And from the subnational government, we have to go down to the ebb of society where we have to start talking about the local government. Because if you look at it very well, one of the responsibilities of the local government is to have complete data of the number of deaths and the number of births in a year. And if we can attest to the fact that the local government are living up to some of their responsibilities, key responsibilities in this sense, whether this responsibility of collecting data, that means the local government within their vicinity, under ideal situation, should have number of all the clinics and number of all the hospitals within its vicinity. And if there are mortuaries within the vicinity of the local government, they are supposed to have that information so that if there is a demise or a deceased report of someone who lost his or her life in the hospital, that hospital, after processing that document, facilitates it by transferring it straight to the local government. Still the same hospitals and clinics, if there are births, like people came to give birth in these clinics and in these hospitals, immediately that is recorded in the database of the hospital. There is a direct transfer of this data to the local government, and the local government, whilst arranging and having been custodians of this data, are not just going to keep this data solely to themselves to be used for their own selves. No, there is another facilitation of smooth transfer of those data from the local government level to the state government level, where we have the relevant ministry, department, or agency at the state level that will have custody of this data. And from that state level, we should have a relevant ministry, department, and agency at the federal and the national government level that the state government should work with in facilitating the smooth transfer of this data to the government at the national level. If we do this, then we'll be able to have a sufficient data bank through which we will be able to channel some of these benevolent activities or disposition coming from the government at the center, the state, or the local government level. This is supposed to be a nexus, a connection from the state, from the federal, state, and local level, where this information will come in handy for the relevant and specific purposes. When the government wants to distribute cash, this specific information will not only tell you that this is the number of people we have that are dead, the number of people that we have that are alive, but will also give you information regarding the economic status of these people, so that this economic status of these people would necessitate the response of the government when it had to go into carrying out activities like the conditional cash transfer. If you are going to send it, they know that they are not going to send it to Toby.
Sorry to cut you short, but I just want to bust your bubbles here. You're talking about interconnectivity between the national, the subnational, the local government. But how many of these local governments actually have an official website to begin with? So how do we even get this across? How do we even get data when a lot, maybe less than 10 or 20%, I'm being modest, 20% of the total local government in Nigeria have an official website? How do we even go by? How do we even begin to compile data?
Revamping this system and creating this for the local government, the state government as well, for them to create the pathway for us to settle the issue of lack of data. So the local government, the state government has an indirect way through which they control the local government. The federal government on their own have indirect way, strategic way to influence the actions, the economic actions, and all other actions of the state government. If the federal government from henceforth has said that the local government are going to be receiving their allocation straight from the federal government, and they don't need to go through the state government for them to get their allocation, then the federal government is going to need to take some very, very drastic actions by saying, just the way before that judgment was given by the Supreme Court, just the way that judgment came forth, and there were conditions that, look, local government should be able to provide 2 years account that's been audited before they will be considered qualified to be able to access their allocations directly from the federal government. In that specific case, the government can also put it there that, look, every local government must have a functioning website. if you cannot put up your own website within the space of 3 months, we are going to take that expense by ourselves to make sure that you, as a local government that has been unable to do that, we are going to design a website for you, get some of your staff that will be able to run it and run the database. Then we will have to remove that money from the allocations that we are supposed to give the local government. And if the government is going to take such to sit up, because this is neglecting the act of e-governance that should also be prevalent at the local government level, because the local government is the government that is even more closer to the people than the federal government. So in this specific sense, the government will need to put some criteria in place that every local government must have a functioning website. And the government is not doing that because it's trying to hinder the local government from getting access to their funds, but to make them responsible. Because to a very large extent, you can see ministries, departments, and agencies, including at the federal level and at the state level, they have functioning websites through which they acquire data and through which they have been able to maintain constant communication with the public. In that specific sense, we have the relevant ministries at the local government level. They are supposed to have websites, and the local government itself are supposed to have websites through which they can facilitate and bring to note, tell the public that these are the strategic projects that we are engaging in, or the ones that we have engaged in, that is of economic benefit to the people at the ebb of society. When this is done, I tell you, most of the social investment program or the cash for transfer programs that the government will want to embark on, the government will be able to do that by bringing this data together, sorting through this data, and be able to fish out the right persons that qualifies for this cash transfer.